just chatting. So make believe nothing happened. I want to say good morning to Dr. Joel Fechisin of Seaview Orthopaedics.
It's actually Fechisin, but that's close enough.
I tried again. It's an F.
That's an F.
This person who wrote this, they're gonna hear from me.
That's okay.
I'm sorry, Dr. Fechisin.
Yes, sir.
It's not exactly common name.
No, it is not.
All right. Seaview Orthopaedics. You're going to tell us what you are, where you are, who you are, and so we'll go from the back. Let's start with who you are.
Okay.
A little fast background on you.
Once again, my name is Dr. Joel Fechisin.
Fechisin with an F.
That's correct. I'm currently a member of Seaview Orthopaedics with offices in Brick, Ocean, Barnegat, Freehold, Monroe, and a satellite office in Lakewood. I was born and raised in New Jersey. I grew up in a small town just outside the Delaware Water Gap called Blairstown, New Jersey. I did college at Lehigh University, and then I went to medical school at Robert Wood Johnson, just outside Rutgers.
Did you wrestle?
I did not actually wrestle at Lehigh. I was actually a football player.
Oh, you were?
Yes, sir.
Okay, I was just showing off my knowledge.
Oh, that's okay. Lehigh is a very good wrestling school. That's true.
What'd you play?
I was actually a defensive back.
Fast, huh?
I was fast. Yes, I was.
A safety, I take it.
I was a safety. That's correct.
Did you hit hard?
There's nothing like getting a 10-yard head start and just hitting someone as hard as you can.
Did you hurt a lot of people's bones?
No, I never intentionally tried to hurt anybody.
I didn't mean intentionally. I thought maybe you hurt bones, and is that led you decided if I've hurt bones, I'm going to wind up fixing bones?
Actually, my own injury history growing up in football, baseball, and basketball, and literally breaking a bone in every single one of those sports led me to orthopedics.
There you go. I was close. I was close. And now you're in orthopedics.
And now I am an orthopedic surgeon, yes, sir.
Tell us about Seaview.
Well, as I said, we have multiple offices throughout Ocean and Monmouth County. We are a multi-specialty group. We cover sports, total joint replacement, spine, foot and ankle, hand surgery, and we also have several pain management specialists. So we literally can cover any part of the musculoskeletal system.
All right. You do things now that, 10, 20 years had to be unthinkable.
Well, I'm actually a total joint replacement specialist. I did my fellowship training at Lenox Hill Hospital in New York City at the Insull Scott Kelly Institute. And you're absolutely correct. Total joint replacement has come a long way over the course of the last 2 or 3 decades. Some of the original implants that we used to put into patients would last only 5 or 6 years. And the implants that we have available to us now are lasting anywhere from 20 to 30 years.
What are we talking about? Most commonly knees and hips?
Knees and hips are what I particularly do. We can also replace a number of other joints, including shoulders and now wrists and ankles as well.
How, I notice here, it says minimally invasive surgery. How minimal can that be when you're replacing a hip?
Minimally invasive is actually a difficult term because it's really misused in the community. Most people think that minimally invasive means using incredibly small incisions that most other surgeons wouldn't be able to use their implants with. Minimally invasive actually means just making an appropriate sized incision where the best aligned components can be implanted.
Okay. So that come to you for knee replacement?
Yes, sir.
How long till I'm up on my feet?
You are on your feet the very next day with physical therapists, either at the hospital or if you choose to do an outpatient procedure at one of the local surgery centers, you'll be up with an outpatient physical therapist the next day.
It sounds shocking, but well, I'm guessing that is because now you're not going to have a bone-on-bone situation, which maybe is what led you to the surgery to begin with. Would I be correct?
That is exactly correct. Candidates for total knee replacements are individuals with certain types of arthritis, could be osteoarthritis, rheumatoid arthritis, certain types of post-traumatic arthritis where there's an injury to the knee itself. And what we actually do is we actually cut the ends of the bones and sculpture them to fit metal implants. And those metal implants are, there's actually a plastic insert that goes in between those. And when the final implantation is performed, There's no longer any bone-on-bone contact.
All right, this is suggesting to me now that you're going to do what do they call it after the recuperation, the rehab.
Mm-hmm.
But I'm guessing that you're going to do rehab now as an outpatient.
Rehab, there's a couple different situations that are available to patients. You can either do your rehab at the hospital immediately after the surgery. There are a number of specialized rehab facilities that patients can go to for as short as several days or as long as several weeks to do their recuperation. Or some of our younger patients who are a little bit healthier can actually go home and do outpatient therapy.
Amazing.
Yes, sir.
I mean that and what typically what would be the time period before a recipient? I'm kind of stuck on the knee. I don't know why. The recipient of a new knee would be 100%. Like let's say it's a golfer.
Okay.
How long before the golfer's back on the golf course playing just like before, maybe even better? How long?
So that's an incredibly difficult question to answer, and it's actually one of the most common questions that we do receive.
All right, how about an average?
Every patient is a little bit different, so everyone has a little bit different pain tolerance, and everyone has a little different physical conditioning. But on the average, you can expect somewhere to 6 to 8 weeks of recuperation, and I certainly can't promise that you're going to have a better golf game afterward.
All right, now let's say it's a golfer who prefers walking to riding in a cart.
Sure.
Will they be able to continue to walk, or will they find themselves
He will certainly be able to continue to walk. Again, a 6 to 8 week time for regular ambulation and maybe up to 3 months before you might be able to walk a full golf course.
All right, okay. You're in Barnegat Brick, Ocean Freehold in Monroe. And I obviously, I say obviously, you've got to have a website where people can go
Absolutely.
and get exact addresses, phone numbers, etc. Rather than try and give 5 phone numbers. Or let's give the website here right now, which is
SeaviewOrtho.com, and we also have a Facebook page.
okay, SeaviewOrtho.com.
That's correct, sir.
All right, go there and you get all detail that you might need. That would obviously include a phone number. I guess phone numbers for all 5 locations. Is there a central number that somebody could call for Seaview regardless of where they're going to wind up going?
Yeah, that's 732-660-6200.
660-6200. For questions, et cetera, and what about consultations? Did you offer any sort of, an initial consultation?
Absolutely. We actually pride ourselves on taking extended periods of time with our patients and explaining these procedures and their conditions in detail. You can actually call that number and speak to one of our schedulers who will be happy to set you up with any number of the specialists in any of the locations of our offices.
And send you where it's most convenient for you, obviously.
Absolutely.
And where do you do the operating?
We operate out of a number of places in Monmouth and Ocean County, including Ocean Medical Center, Jersey Shore University Medical Center, Monmouth Medical Center, and a number of Surgicare centers throughout the region.
Boy, okay. I wish we had the time so we could talk football for 15 or 20 minutes.
I'd love to.
Unfortunately, we don't. And but it's just great meeting you. And I sometimes I can guess somebody's professions. I wouldn't have guessed you for what you are because you, and yet you don't look like a typical. You got the body, but you just don't look like somebody who was running around really hitting people.
Yeah, I get that quite a bit, actually.
All right, it's pretty good. Seaview Orthopaedics and Medical Services. Again, the phone number is 732-660-6200. And if I was getting a replacement, I'd want to come to you.
Well, I appreciate that.
Because I like to like my doctors. I think that's important.
Actually, I think it's a very important part of the patient-physician relationship. You have to be comfortable with the physician you're seeing.
All right. I could have gone on with you for an hour and enjoyed every minute of it.
Would have been my pleasure.
Thank you for coming in, and the best to you. I know it was going to be a long career, and as much as things have improved, I guess we can look forward to more miracles down the line, huh?
There's no question about it, sir.
Have a good day.
You as well.
Okay. It's, well, we're there.